Hey, Cam followers. Yes, we're back. This is going to be amazing. I say this every time, but this is going to be amazing. Chelsea's been with us before. We've had amazing chats. We are only here for an hour. This last time, I think we started hitting like 1 hour 45. So I am going to be putting the brakes on. So if you've got questions, get them in promptly, and we will do our level best to answer them. Chelsea, tell us a little bit about yourself so that people know what to expect.
Right, I'm Chelsea Dawson from True North Veterinary Wellness. I'm a vet. I'm originally from Canada, but I've lived in the UK for 15 years now. 15 years this weekend, actually. It's my anniversary. So I used to work in GP work, and I did my qualifications in chronic pain management and acupuncture. On the back of that, started doing chronic pain clinics, and on the back of that, started getting asked lots of questions about herbal medicine, and I could never answer the questions. So I got to the point where I thought, you know what, to be safe, I need to do sort of a basic, just get the foundation so I can at least answer clients safely. And I did that and was hooked. And then I read everything I could, took as many courses as I could. There's not, or there wasn't at that time, that much out there, especially in the UK. But I did as many online things as I could. And now it's sort of a day-to-day part of my clinics. I can't imagine practicing without herbs. On the back of that, myself and a colleague wrote a foundation course that we launched in 2019 for vets. And so that's a UK-based veterinary herbal medicine course, just to give other vets a good foundation to be able to go out and start using it in practice.
Amazing. So we can put a link to that, so anybody that wants to know and be able to get hold of it. Awesome. So I'm just going to do a little bit of a shout out because we have to use this space to tell the world about what we're up to. If you haven't heard about our booklet, please listen in. This is an illustrated children's book, and it is designed to resolve the problem that we have in our chronic pain epidemic, where many of these dogs are basically misinterpreted, and unfortunately, through an unwanted behavior that they've been almost pushed into doing because they're actually uncomfortable, they're in pain, and someone's bumped into them, someone's landed on them, somebody's not respected their personal space, they maybe lash out. And with that, they then get labeled. And that labeling might mean rehoming, or in some circumstances, it might even mean euthanasia. So this book was written to try and help families understand how dogs present pain, so that if they have that in their house, that they can start making allowances so we never get put in that position. It's available in the shop. It's a beautiful illustrated children's book, but it is suitable for adults too. Cool. That's the little admin done. Right, let's dive in. And I think, being very organized, we have an agenda. And number one on the agenda, I have put the title, Established It Is Not a Case of Them and Us. And we're just going to stay here for a little bit because I think there's a real tendency for people to believe it's one or the other. What's your thoughts on this?
I completely disagree. I don't think it should be us versus them. I don't think it should be like that with any of the therapies, treatments and therapies that different people use. I've always been a big advocate of multimodal approach to pain management. And yes, multimodal is absolutely different types of medications, because they all work in different ways, and all of the things that you guys advocate for, the lifestyle changes and home changes, that kind of thing. But I think multimodal also can include all of the other things. So certainly with herbs, like I said, it's a huge part of what I do, but I'm not using it as an alternative to medication.
Right.
And I would say that I don't know any herbal vets that are using it as an alternative.
Yes.
All of us are using it as a complementary therapy. And I think that they balance really nicely. So when we're using medication, we can use herbs alongside to optimize that medication and to have some other effects. So I always tell people that for me, using herbal medicine fills the gaps that conventional medicine leaves.
Okay.
So go on. I'll just keep
Yeah. And I think it's worth saying here a few more regulatory stuff. So we as vets are bound to a code of conduct. And within our code of conduct, animals' welfare is absolutely paramount. And we are instructed to work on an evidence-based basis and also to follow something called recognized veterinary practice. And that means that we have approaches that have evidence and are established to be effective for the best of that animal in our care, in effect and safety. So choosing to do the complete opposite to recognize veterinary practice is a little bit of a dangerous game, really. Mm-hmm. So what I would say is that I personally think if this is within your area of wish, this is your area of want, do bear in mind that the vets that you're dealing with, they are bound by this code of conduct, and respect that. And hopefully the vets that you deal with also respect the code of conduct. And as Chelsea is saying, combine the two approaches rather than picking one or the other, if that's the way. Is that fair to say?
Yeah, absolutely. I think so. I get lots of people contacting me expecting me to be able to get their pets off of medication. And the very first thing I say before I even do an assessment, because there's no point in us getting together and spending lots of time and money on things if we're not going to see eye to eye on this. And I always say, the odds are I'm not taking your pet off of medication. If anything, I'm probably going to put them on it.
Yeah.
And I will also look at herbs. We will also look at optimizing that treatment. But especially when it comes to pain, you really don't have herbal options. And that's not really how we use herbal medicine anyway. I don't look at herbs and say, right, your pet's on an anti-inflammatory. I'm going to take an anti-inflammatory herb and take them off of the medication. It doesn't work that way. That's not how anti-inflammatory herbs work. One of the things that we teach the vets on the course that we have when we start talking about analgesics, pain relief, and anti-inflammatories, a lot of the vets that we get are a lot of the sort of chronic pain type vets. Yeah. And everyone's excited to learn about that. And we go, just so you guys know, we're not going to give you anything that's going to replace any of the medication that you're using. There's absolutely nothing. There are herbs that may reach those sorts of pain relieving levels, but those are like the classified herbs that only incredibly qualified and very specific training type herbalists are allowed to get in very small quantities. What we can get even as herbal practitioners, sort of your basic herbal practitioners, is not going to touch your things like your gabapentin, your Medicam, that sort of thing. They just don't work the same way. So yes, especially when it comes to pain management, medication is always the top of my list. And then we sort of fill in the other blanks, or we start to add other things in to help support that. The other thing to recognize as well when it comes to medication versus herbs from a chronic pain point of view is herbs don't work quickly. Herbs don't have the quick effects that the medication will. So 99% of the time, a chronic pain patient of mine will go on to whatever medications, whatever combination, whatever cocktail I decide to mix up for them first to get a certain level of pain relief as we're adding in the herbs, because they can take weeks, sometimes months. And I'll get into a bit of why that is. But really, when you've got a chronic condition, herbs take a while to unravel that chronic condition. It's about optimizing health, really. And so that's, if I say, yeah, it might make your animal comfortable, but it's going to take 3 months.
Yes.
Let's have some Medicam that's going to make them feel better.
You know what? I did. I am Captain Blunt Pants, and I'm okay with that. And I did a really facetious slide once about how a lot of these interventions take a long time to take effect. And they had a little dog going, excuse me, I don't want to wait 3 months. Kind of sore now. Can we sort it out now? And I think people really do need to take that. If you had really bad toothache, like absolutely mind-blowing, you really don't want somebody to go, oh, no, look, do you mind if we just put you on something and it will eventually subside, probably about 3 or 4 weeks. You're not going to want that, are you?
And especially in our patients, because we can't reason, we can't have the conversation and say, I'm going to give you this. It might take a while to kick in. They just know what they're feeling in that moment.
Yeah.
So coming back to sort of the code of conduct and whatnot, yes, we do have to use things that we know are going to work more or less in the same way reliably for every patient that we put on that medication. Obviously, there are some individual variations there.
Yeah.
And that's the difference with herbs. Herbs don't work that way.
No.
And I can't say that one herb will work in the exact same way for every patient.
That's why I put. I keep looking at my notes because I am, and it wasn't a case that I could bullet point this because there is a lot of ground cementing conversations that need to be had before we actually start talking about herbs, because we don't want anybody to come away from this thinking that this is an alternative practice.
Yeah.
We had a clear conversation before this live, making sure that we do demonstrate to the public it's not a them and us. It isn't this is replaced by this. It just doesn't work like that. And some of the things that I wanted to include, delving into about owner wishes and how that conversation that you have with an owner saying, look, I know that's your wish, that's your belief, that's what you would like for yourself, but we've got an animal in pain in front of us that wants that pain controlled. I've also put down about how people online are likely to listen to these really quite well-marketed stories of how it all works. You take this away and you replace it. Touching upon how every dog is individual and what works in one may not work in the other because there's so many permutations of arthritis. If we think about arthritis of the elbow in a young Labrador that's 2 years old, it's going to be really different to hip arthritis in a 12-year-old Spaniel who's also got kidney problems, cognitive dysfunction. So arthritis is a very broad spectrum of diseases. What works for one isn't going to work for all.
Yeah, I think equally so. I mean, even the 2-year-old Labrador with elbow dysplasia and elbow arthritis and another 2-year-old Labrador with elbow dysplasia and elbow arthritis are going to be experiencing their pain and their discomfort very differently.
Yeah.
They're different dogs, different families, different lifestyles. And I mean, pain, really, if we're going to get really deep about it, pain is all processed in the brain. It's all, when people say, oh, it's all in your head, it literally is all in your head. And how it affects our moods, how it affects our demeanor, how it affects everything varies from individual to individual to individual. And that's why the multimodal and individual approach, I think, is best for all animals, whether you're doing it conventionally or with complementary therapies as well.
Yeah. And I'm not going to put Western established therapies out of we need to check if they work, because there are situations where putting them onto a recognized veterinary practice just doesn't cut the mustard for that dog. So no matter what intervention you choose, you have to be the animal's advocate and check in. Has it made a difference?
Yeah.
And if you're thinking, what you're talking about, please go back and watch one of our lives about objective monitoring, because our brain is so clever at tricking us. So it is likely, and I'm going to mention Jono. Hey Jono, I see you there. It's very likely that because of his beliefs and going on a Western-based approach, having put his dog on a non-steroidal, which is the foundational intervention with huge amounts of evidence and efficacy, he could sit back and go, well, he's got Metacam now, it's all okay. That's not now.
Oh, you've set the pug off.
Oh, the pug going as well.
Yep.
But so for him, that fulfills his beliefs, and he might therefore not question and accept. Whereas somebody else who's into herbs and alternatives, having established what they believe in, they sit back and don't question. We all need to question whether it is working for our dog. Fair?
Yeah. And I think it happens on, like you say, on both sides. Some people who are so anti complementary therapies and must be scientific evidence based, which, surprise, some of our herbs do have really high levels of evidence base. But some people are really, really into that sort of conventional side, and that's all they want. And other people, it's all natural or nothing.
Yes.
Which in itself has problems. And I think we have to meet in the middle.
Yes.
And that's, I say that I tell people when they want me to take their animals off of medication, that's, absolutely not what I'm going to do. that was a bit blunt. I obviously worded a bit nicer. And we have a conversation about why I want to put them on the medication. I hear what you're saying about the herbs, and absolutely we're going to look at those as well. But we're going to do it in a way that is going to be the best likely outcome, the best option for your dog, and we're going to use sources that we know are good quality, practitioner grade, that sort of thing, not the stuff that you just kind of get online or over the counter or that aren't quality controlled.
Yeah, and I think that's another thing. So I'm doing a lecture on supplements for the Dog Academy soon, and they're probably going to be disappointed in me because the first 2/3 of the lecture is not actually talking about in a form of a reference library of this. It's actually all of the legwork that comes first of let's think about this. It's not regulated. No one's looking at product control. There's no quality control. There's no efficacy. There's no safety studies. Every batch might be different. And I think people do need to remember that, the thing with medications is it is very well regulated. At least, in a gabapentin capsule, there is gabapentin
Yeah.
and exact milligrams.
And that's all it is. It's not mixed with something else or laced with something or
So, okay, so we've dealt with that. Great. So now that everybody's like, can they just shut up and get on with it? Let's just talk a bit about like historical herbal medicine, because no one can deny that preceded our Western-based approach now. True?
Yeah. So it was right up until the 1960s. I mean, in the 1960s veterinary textbooks, there's huge amounts of information about how to use herbs as medicine, because that was the mainstay of veterinary medicine. Vet medicine is not really any different in its history to vet herbal medicine, is not any different to human. As soon as humans started domesticating animals, either for hunting or livestock or pets, we very quickly realized that it was in our interest to keep them as healthy as possible. So we started using the same remedies we were using for ourselves. And at that time, that's what we were using. We didn't have the sort of conventional medicine or scientific approach and that kind of thing way back then that we do now. And that sort of evolved in the same way as human medicine over the years.
No, that's cool. Yes. So now I think we've done the fairy tale, we've done people's beliefs, we've done about the historical thing. Let's actually start tackling the sort of herbs that you would use. And you've already said you don't actually use it with a focus on pain. You're using it in the true sense of the word holistic.
Yeah.
And I think this does bug me a little bit, because I do get frustrated when people spout that word here, there, and everywhere. And holistic really does mean treat the whole. And it doesn't mean that you've got to have a loyalty to alternative or a loyalty to Western. It's about just looking at the bigger picture and treating the mind, the body, and potentially even the environment that person chooses to exist, because it will have an impact on the body. Rugs is part of a holistic approach. So what's your mindset when you're bringing herbal into a chronic pain management plan?
Okay, so for chronic pain, well, for any patient that I'm looking at for herbs, I make a list. I have lots of notes everywhere, notebooks full of lists about patients. And what I look at is I sort of make a list of what the patient's issues are. So elbow arthritis. And then I talk about, I'll make a note about any kind of muscular discomfort, trigger points, tension, muscle wasting, that kind of thing. But then I'll also look at the rest of the patient. So we look at liver and kidney support. It might be a patient that is already on long-term medication. It might be a patient that is struggling with the long-term medication because it's having some kidney issues or that kind of thing. Anything else that might be in that patient's history. So it might be a patient with arthritis who also has a sensitive stomach, or who has a history of ear infections, anything like that. And then it's some of the more sort of nuanced things, I think, and you'll know this from the way that you practice and examine animals, but yes, we have a sore elbow, but all of the other postural things, all of the muscles, do we have really tight muscles? Is the joint cold? Are we getting, poor circulation in that area because it's a really old end stage arthritic fused up joint, that kind of thing. So just looking at everything really. And then
also looking because I know especially with an acupuncture, like a traditional acupuncture approach, they're looking at circulation. So they're looking at pulse, they're looking at color, as you say, temperature, they're looking at how the skin feels. So you're taking in lots and lots of information and not just honing down on the primary problem.
Yeah. And I think so yeah, I guess I should have explained earlier as well. Like I'm not traditionally trained. I'm not a Chinese medic or anything like that. Mine is all Western approach to herbal medicine, but we do still use some of the similar principles and same principles. So we do look at things like temperature. I do look at pulse quality. Maybe not from the traditional point of view, and that really depends on what tradition you're coming at it from. But I do gather lots of information from that. And so, as we said before, one arthritic elbow is not the same as the next arthritic elbow. It might be, early stages, and there's still, lots of hot inflammation, heat, and that sort of thing, or it might be very stagnant and cold and stiff and just So you can get lots of variation between patients.
So you've got your list, and then
so I do
I almost see like Post-it notes stuck on a wall, and you're like,
oh my gosh, the number of like notebooks I have laying around this house is just, they're everywhere for lists about patients. So I do my list of the patient's issues, and then on the back of that, what I need for each of those issues. So what is it that I'm looking to achieve with each of them? So they have their arthritic joint. Okay, I might want to include some anti-inflammatories or some pain relief. But then if I look at my conventional list, well, they're already on some really good anti-inflammatories, really good pain relief. So I might not need to use a herb for that. It might be better to look at herbs for other things. For the tight muscles, those, poor circulation, those cold joints, that kind of thing, I might look at some circulatory support. Or a bit of a relaxant, something that's an antispasmodic. So in conventional medicine, we have our muscle relaxants, which are quite heavy duty medications, and some animals need them if they're incredibly, incredibly painful. But we don't have anything that's sort of just a bit less than that. And herbs, we find, often help with that. So we are improving that circulation out to the achy parts. We're helping to relax the muscles off a little bit. To help get our medication and our nutrients out and bring all of the toxins and your lactic acid.
I'm just going to butt in here. You've got the same multimodal approach to me, that you wouldn't be averse to sorting out some heat sacks and some hot tea towels and a warm hot water bottle wrapped in a towel, and also suggesting an outward in rather than an inward out approach.
Mm-hmm. Yeah, and it's both, and I think, definitely the heat therapy and cold therapy, depending on what's going on with the joint or surgeries and things like that. I mean,
hugely underutilized.
Hugely, yeah. Oh, I use it so much here that, like, my 3-year-old son this morning, I woke up and he said, "Mommy, my tummy hurts. Can I have a warm cloth?"
Yeah, I know. It's crazy how much we can use it ourselves, but we forget to use it on our animals. And I've just been doing a lecture for the London Vet Show talking about the owner-animal bonds and how, in any plan, we should have it in the background going, how are we maintaining the bond? And spending time with your animal whilst watching a TV program and just using a heat sack and doing some gentle massage techniques and just doing passive range of motion and just being with them can have a massive impact on mind and body. But anyway, I digress. So we go back to the herbs. Yes.
I was going to go off on a tangent there, so I'm glad.
Sorry, that was my fault.
So I make my list of what actions I want from my treatment. Then I compare that to what they're already on or what I'm already achieving with my acupuncture, physiotherapy, and that sort of thing, and see what I'm left with. And that's what I use the herbs to fill in.
Right.
And oftentimes my arthritic patients will be on an anti-inflammatory herb, not because I think it's going to replace the non-steroidal that they're on, but it may help optimize it. The other reason is because herbs have more than one action.
Yeah.
And that's another one of the differences between sort of allopathic or conventional medicine and herbal medicine. So things like boswellia or turmeric even, both of those talked about a lot as anti-inflammatory herbs. Both have their place as anti-inflammatory herbs. Both also help to support circulation.
Right.
One is more warming, one is more cooling. So they have different things that they do. So it's trying to narrow it down. And I usually try and narrow it to about 5 herbs that I'll put in a blender in a mix. And a lot of those, one herb will cover several different things.
Yeah.
One of the big things that I would use is something called adaptogen herbs, and that's something we don't have in conventional medicine. So adaptogens are, I could talk for like 4 days about adaptogens. So in a nutshell, adaptogens are herbs that help support the body through stress. So that might be emotional stress or physical stress. So each of them work in different ways, but essentially they help to support the immune system. They help to support the adrenal glands. And yes, there is research on this. This isn't just,
that's what I'm going to
this isn't just a traditional concept. And actually, adaptogens are actually a more sort of modern concept in herbal medicine. They're not really a traditional thing. And there's loads of different adaptogens. And so every chronic pain patient will go on an adaptogen. I just have to figure out which one's the right one for each patient.
Yeah.
So some will be more stimulating, some will be more calming, some will have some circulatory effects. So they're all different. Some will have effects on liver and kidneys. So I think I've mentioned astragalus on my last talk here. And astragalus has lots of good evidence for kidney support.
Right.
But it's also an adaptogen herb and has good immune effects and things
and
like
I think
that.
we need to remind ourselves that one of a supplement that we use routinely in vet medicine is SAMI and milk thistle and the sibyllin complex. And many veterinary practitioners will use products such as hepatosil, denamarin, and we see pretty explosive changes. We'll see liver values that were quite high, ALP, ALT, and they come down relatively quickly. Obviously, that's not a clinical trial. We haven't got a cohort of 100 dogs exactly the same condition, exactly the same age, exactly the same breed, living in exactly the same way. And we cross-compare those that don't have denamarin to those that do and see what happens. But there are herbs that are being used in allopathic approach.
Yes.
Recognized veterinary practice.
Oh, boswellia is in loads of the supplements that vets are using now. Turmeric is. Some of the liver support ones have that in it. I'm a bit like this about that. A lot of them have things like, some have passion flower for calming, some have ginkgo for cognitive function.
Yeah.
And these are all ones that do have some really good evidence base, and so it is there and it is being used, and it is being used by your sort of conventional.
So with the evidence base, so not to put you on the spot, but I am Captain Blumhouse. When you talk about evidence base, one of the things that I get a little bit twitchy about is this appropriate clinical trials in a relevant species to what we're talking about? So we're not talking about rats or mice that are in labs, and it's not humans. We're talking about dogs with generalized OA in a lifestyle close to what we expect situation. Have we got evidence in those cohorts?
Short answer is no.
Right.
Don't have that.
Yeah. But that is common with a lot of things. And let's be really honest, we're very privileged with medications that for a drug such as a new anti-inflammatory to come to market in the vet profession, these aren't lab animals anymore. These are trials that have gone out into the public sector with real life cases of owned dogs with OA. And those trials, I'm just saying this so owners understand the difference. Those trials will have hundreds of animals in them, not 16, not 8, not 22. We're talking 200, 300, 400. And then these companies will have to collate evidence again and again as their field of use expands. So they will end up having data on thousands of animals, and they will have years worth of data on side effects. So the only reason I'm saying this, and I know that Chelsea won't mind me saying this because she's a vet that has both approaches, recognised veterinary practice and herbal, acupuncture, physio, etc. That is quite different, isn't it? That is something that we would love to have in rehab. We'd love to have in, different approaches, but it doesn't exist. So when you say evidence, you are saying evidence that is likely in different species and extrapolated.
Yes. Yeah. And I think there's lots of issues with research in herbal medicine. There's lots of reasons we don't have the evidence that you're talking about.
Yeah.
And there is lots of good evidence out there. So it's about knowing where to find it. So, for example, I said astragalus earlier, we've got positive systematic reviews and meta-analysis for that. Now that's in humans.
Yeah.
So we have to extrapolate. We have that for things like hawthorn and ginger for anti-nausea and things like that. So that there are really good evidence bases out there. But why has that not then trickled down into, we've done lots of clinical trials like what you've just been describing?
Because it's expensive.
And the pharmaceutical companies, and bear with me, I'm not being down on big pharma here, but it does not make good business sense for them to invest that much money into looking into a product that people can grow in their garden or get over the counter or go foraging for.
I can see that aspect, but
what they tend to do is try and find the one chemical in a plant that has that effect.
And isn't that it's not that I feel that they're doing it in a cynical way, it's because it's going to be consistent.
Well, yeah, and you don't get the consistency in the plant, which is why they try to figure out what chemical in the plant is having that effect. And that leads me into a whole other thing in herbal medicine, because we use the whole plant or the whole part of the plant.
Yeah.
We use something called synergy. But they tend to try and extract that one chemical so it can then be synthesized and consistent. So I'm not saying that it's a cynical thing. It just doesn't make sense to put that much money into something that isn't going to have an outcome for you.
No, absolutely. And it would never go to market. So the VMD is the Medicines Directive. Yeah. So I think just to elaborate that. So for something to be classified as a medicine, it has to go through a very strict process to be able to be marketed as a medicine with medicinal claims. And for that, it has to be consistent. It cannot vary. And like we said with gabapentin, there is gabapentin in those capsules at a certain milligram per capsule, and it is to the T. And you can't do that with other modalities, be it herbal, be it acupuncture, be it physiotherapy, be it hydrotherapy. And that creates quite a massive variable there, which I'm hoping that we're going to kind of like progress on how to help people navigate this field as much as any of the others, is that you have to be able to be objective and feel empowered to monitor the progress. So if I was coming to see Chelsea with Luna, and I would ask the questions of, what are you doing? Why are you doing it? What should I see? How long should it take to have effect? And I would monitor. I put in my diary, she said it's going to take 3 months. And I would look in 3 months. Am I having reduced acute flares? Does my dog's demeanor seem improved? Am I maintaining a constantly better quality of life? And then I would make that decision, is this worth the investment, both in time, emotions, and money, or should I be trying something else? Is that a fair approach, would you say?
Yeah, and I would say that as a herbal vet, that's what I do. I mean, I change the mixes around as well. So one of the other reasons that the evidence doesn't really work in the way that we use herbs is because it's so individual.
Yeah.
And we don't tend to use, I mean, I could count on one hand how many times I've ever prescribed one singular herb to a patient. It's always a blend. It's always a mix, because we're treating holistically. And you can't research that because each individual will have a different blend or have a different mix. So that's why it gets a bit difficult. But to come back to what you were saying there, monitoring things, we do these blends, but the number of times I go back to the drawing board and go, right, that's not quite working. What am I going to do now? What am I going to how can I change that?
Yeah.
Why did you have that reaction to it? And some dogs have bad reactions to the herbs. I've just mixed up a new blend today for a Wobblers patient that I have, because the first one I put her on, I don't think she did as well as I was hoping. In fact, she seemed a little bit worse on it. So I said, stop it. That gives me some information about how she's reacting.
Yeah.
Maybe I put too much, stimulating herbs in there. I'm going to try something else.
Yeah.
And so, it's not a case of take this pot away and it's going to cure your dog and that's that and it's going to stay on that forever. That's not how herbs work.
No, and it doesn't. And it's the same with medication. It's very common for people to be prescribed a non-steroidal plus an adjunct, or even maybe two. And on review, the adjunct has made the dog tired, wobbly. They're not sleeping so well. They seem agitated. So we're not, just because it's a recognized veterinary approach, it's not immune to having to be treated the same. We need to treat the individual. And this is why empowering owners to know what they're dealing with, ask the right questions and have the right expectations, and be willing to change and challenge. That's important. No matter who you're talking to, be it a vet therapist, a herbalist, a hydrotherapist, you need to be able to know what you're expecting. And if it's not meeting those dizzy heights, step in and say something and not feel embarrassed about it.
Yeah, absolutely.
Love it. Okay, so we've got a few questions. Let's do a few questions, because there's no way in the world that we were ever going to be able to do some kind of reference list, because I think Chelsea's really made it clear that it's not a case that she's going to mention a herb and you're going to be able to pop on Amazon and start introducing, because it just doesn't work like that. You have to be working with a herbalist to get the best out of it. And I think sometimes people are really misled by the readily available blends that you can buy online that have these claims. I'm a cynical old witch, but there you go. Let's start at the beginning. So we had a couple of really good ones. I love that Jono's here. He's probably going to send me a message later telling me off. Here we go. Here. Do you think vitamin C within the green leaves plants may play a part of this success? I understand vitamin C can help boost the immune system and more.
Yeah. So I think Vit C is often used from an antioxidant point of view. So antioxidants are huge. That's one of those things that's often on my list for my chronic disease patients. So yes, Vit C, particularly in certain herbs and plants. The thing that I would say about using things like green leafy plants is that if you're using something that's fresh, if you are expecting it to get to medicinal levels, you would have to feed your dog buckets of leaves.
Turn into a cow, basically.
Yeah. Dogs, carnivores, are not very good at processing that sort of thing. So with herbivores, if we're treating herbivores, we don't have to use as many herbs. It doesn't have to be necessarily as highly concentrated, because they're so adapted to processing that and absorbing those nutrients. Whereas if we're using it in carnivores, and even with ourselves, to get to the medicinal levels that you need to have sort of effects of many of these herbs, using fresh plants isn't necessarily going to get that. That's not to say it's not healthy and might not be supplying some nutrients, but if you're looking for a very specific medicinal effect, that's when we want to be using your dried herbs, because that takes out the moisture, so it concentrates the active chemicals in it.
That leads into this very well then. Now, this is obviously a very tricky subject. It's a very emotive topic, and it's very easy to offend people.
And trust someone whose dog I treat to ask this question.
It's really hard. Like, one of the things I swear to God, followers, I always try and make sure that we look at these things objectively and don't add any kind of sarky humor or anything. But seriously, what is your thoughts on this?
So I have a very good friend who's a vet and a veterinary herbalist, and she says cats eat lilies and lilies kill cats. So leaving a cat or a dog up to self-selection, I question. I do know some people who do it. I think if you're dealing with a herbivore, it makes a little bit more sense in my brain. But with carnivores, I'm not convinced that it's all that use. I mean, my dogs eat everything.
Yeah. I think we all know that dogs will eat grass, and cats eat grass, make themselves sick. And there's for me personally, and this is just my personal opinion, I think there's quite a lot of wishful thinking with it, because we as vets see the dogs that have eaten toxic substances left, right, and center. They've eaten things that have got obstructed, and you sit there going, that doesn't make sense. So I've got quite a cynical. But if anybody has got good literature about it, then please send it my way. I'm not blinkered. I am open-minded.
I think there's definitely some. It makes sense. Some of them, when we talk about sort of animals eating soil, and sometimes there's nutritional deficiencies and that kind of thing. And I do think there is some evidence for that. But from a self-selection for medication point of view, I have yet to be convinced that zoopharmacognosy, that's what it's called, the self-selection, that does work. Again, it makes more sense to me from a herbivore point of view, who are doing that anyway in the wild, self-selecting plants and things.
Are they self-selecting, or are they avoiding?
That's the other thing. Yeah. So I have yet to see the evidence. I know there's some people who do it, but I'm not a believer just yet.
Okay, next one. When owners notice quick results with herbs, is it likely caregiver placebo? And that fits in really quite nicely with somebody wrote down here. Somewhat depends on herbs. Some can be very quick. I've seen effects within hours using sedative and anti-anxiety herbs. Most need to be considered a long-term approach. So what's your view on those?
So, hi, Natalie. Natalie is another herbal vet. So I think it depends on what you're treating. And absolutely agree with Natalie. So some of the more, when we're using it from a behavioral point of view, calming sedatives, you'll have heard of valerian. We use that particularly in cats. Cats love valerian. She just told me not to quote her. So yeah, I agree. Absolutely. I think when there's a behavioral of an anxiolytic type effect, I do tend to see effects quickly. Absolutely. There are times where I've had patients who the next week after going on or getting onto the full dose of herbs, and the owners come in and go, oh my God, he's brilliant. He's absolutely brilliant. And I'm going, oh, okay, is this caregiver placebo? Let's see how we go with this. And there are definitely some that do have effects very, very quickly. When I say it can take months, it depends on what you're treating. It depends on the chronicity. How long have they had that condition? How long have they been struggling with it? How much do we have to unpick and unpeel in this patient? So chronic pain can be one of those trickier ones that can take longer. Chronic skin is the other one that takes forever to see effects. And in those situations, when it takes longer, I always have those conversations up front with the owner. And what we're looking for is the longevity of it. So a lot of people will say, well, the animal is going to get better anyway. So in 3 months' time, it might have been better anyway. How can you say it was your herbs? I don't. I would say right now, let's see how long we go before the next flare up, or how quickly they recover from the next flare up, or that sort of thing. Whatever.
That's something that we should talk about. I think this is really important, because no matter the intervention, time can be a healer in OA. Okay. So people tend to seek assistance when they see deterioration. And most owners don't know that arthritis naturally waxes and wanes. So you are seeing, when you seek medical support and you go to the vet, it's probably when you're at a wax. Okay. And whatever intervention you introduce, it's going to coincide with the resultant wane. It's going to wane anyway. So when you're saying whether an intervention really is working, especially with an intervention that's going to take time to affect, it's not like a light switch. It's going to have to work in the system. One thing that would be amazing for people to do is to look at the frequency of flares, because if an intervention is working, and that might be lifestyle change, that might be weight loss, that might be a pharmaceutical, it might be a herbal approach, hopefully you should see fewer flares, less amplitude to the flare, so less severity, quicker recovery. And that's one way to say whether these slow to affect is actually worth, and let's put it honestly, it's worth the investment, because none of us, I haven't got a money tree. You know, when I blow 100 quid on something, it means I've got 100 quid less to spend on something else. And, you know, I want to know reasonably promptly, is this worth my investment? Because otherwise I want to be looking at something else. And Jonah, I'm not ignoring you. It's just you write too much, okay? I'm agreeing with you. And
I'm only half reading those comments going.
I know. Don't give him any rope, because he will take it.
I was just going to say there, one of the things that the two things, it's one extreme or the other, I find when I get clients coming in for the first time, or when I first see a pet. I either have patients that the owner has put them on one sole herb because they read that turmeric is good for arthritis, which I've already explained is not one of the ways that we would use herbs. Or I get them coming in with the shopping bag full of all of the supplements they've bought, because they saw that this worked and they saw that that worked. And when we unpick them all, I could narrow that down to 5 herbs.
Yeah.
Because each of them do so many different things. You don't need all of those. You shouldn't need all of those. And the amount of money that people spend, and time and energy, and you know, the stuff that goes into pets' food that ends up looking more like just a bowl full of, you know, dried
Well, that
dirt.
was something else I was going to say, is that I think people need to also remember that the dog's got choice. And if you're making at 2 or 3 occasions in the day unbearable, and you know, that needs to be taken into consideration. You know, at the end, Holly, she enjoyed her feeding time and wanted it to be pleasurable. And if I was shoving stuff that was bitter tasting, unpleasant, that was just another part of her happy world taken away from her. So just be cognizant of that, guys. There was a really good question up here. I'm just trying to find it. Let's do this one. Is it this one? Yes. So this is going to be an impossible question to answer, Nikki, I'm afraid, because we can't see your dog, and every dog is an individual. And I feel awful saying this to you, because a lot of people want to go online and have answers so they can put them into action quite quickly. It ain't possible. For all we know, your protocol could be perfect. Your dog could be absolutely fine, and what you're seeing is not pain, you're just seeing dysfunction. And your dog is slow because they haven't got the physical capabilities anymore, and it's not underlying pain. So what I would suggest in your situation is to speak to your vet, or maybe seek the help of a physiotherapist or a pain practitioner who can really give you the lowdown of where you're at with the pain. I don't know how Chelsea feels about this, but being acupuncture, I'm pretty sure I know what her comments can be, is that if you've got loads of trigger points and you've got tight muscles, and you know, chucking more things into the system might not be what you want to do, and you might want to be doing a more physical approach of hands-on and acupuncture. True?
Absolutely. Yep. Absolutely.
Cool. I love it when we agree. This is a good question. Do conventional medicines affect herbal remedies, and vice versa?
Yes. Another good question, Judy. So absolutely. And one of the things that I do when I prescribe herbs is I give a client an information sheet with exactly what herbs I've put in, why I've chosen those herbs, and potential drug interactions. So obviously any medications the animal's already on, I will take into account, but I don't know if they're going to end up having to see their regular vet and go on something in the future. So I send that to the regular vet, the GP vet as well. So they have that on record. So in an emergency situation or something happens and they're going to change medication, they can cross-reference any sort of potential drug interactions. You can also get herb interactions. Usually those aren't as concerning, but using certain herbs together, sometimes you can either dampen down the effects of one or increase the effects of one, and it might not be a desirable effect. So there are lots of drug herb interactions and herb interactions.
Perfect. There was another good question up here. This is more just a conversational one, which I think is a really good. The reason me and Chelsea are talking now, let me just talk about our selection process. we don't just randomly pick any other person to come on alive. There is a definite thought process of, do they sit with a very balanced viewpoint and they're not an extremist? Because we want to give you guys the best balanced conversation possible. And so Chelsea is a absolute star for me because she is a vet and she's gone through Western-based practice and training, but she's also stepped away and she has a respect for both. Now, talking about this, there is definitely a trend into this area. It is trending, isn't it? It's really coming back with vigor. And I just want to make sure people have a balanced understanding when they go out and look for these interventions, because there's pretty ruthless marketing to appeal to people's beliefs. And let's just think again of that dog. The dog doesn't care what your belief is. That dog just wants their pain taken away so they can get on with their life. And we have to be really aware what our beliefs are and how they impact on our beloved's health. Yeah. So yes, they are trending, but whether that's going to equate to clinical trials, I don't know.
And I don't know that it's possible because of all the things that we've talked about.
Yeah.
You know, I can't sit here and say that I can give you clinical trials and really strong evidence for every single herb, for everything it's ever been described to be used for.
And I think even if someone gave you £1 million,
I won't even touch it for one herb, one condition.
You're not going to be able to do it because it's just impossible.
I think, yeah, I do think there's a trend that way. I think there's a trend that way in humans as well. I mean, especially in the last couple of years, the last 18 months, everybody's really focused on health and well-being and nutrition and the gut microbiome and all of that. So I think that the pendulum is swinging that way, but just because owners want it doesn't mean vets should be doing it.
Yeah.
First of all. Second of all, if a vet doesn't have the knowledge, they shouldn't be doing it.
No.
You don't want me to do the orthopedic surgery on your dog. You don't want ultrasound scanning. I'm rubbish at ultrasound scanning. That's not my area of expertise. So, you know, it's just because your vet doesn't do it or doesn't have that knowledge doesn't mean that they're not a good vet or they're not.
No, but then it's just so easy to pop online and buy something that you think just fits the bill and it doesn't.
That's where therefore equals pound signs. I would say I would be more worried about those online companies and those over-the-counter products with all the marketing and whatnot who are just making quick money off of these sorts of things. And if I'm being completely honest, I don't know many herbal vets who make much money off of the herbs because the quality of the herbs that we use are practitioner grade and quality controlled and whatnot. They are expensive. So there's no room for markup.
No, absolutely.
Very little anyway.
Talking about gut, I think this is the sort of approach that Chelsea would be looking at. So with dogs that have no gut issues, how would they fare? That's where she's coming from. So she's not just looking at the painful stifles or the throbbing elbows. Mm-hmm. She's considering, okay, so this dog's got gut issues. How can I help them be on a recognized veterinary product? Yeah.
And I think herbal medicine is really good for guts in particular because a lot of gut issues stem from inflammation of the guts.
Yeah.
But we know that non-steroidals can exacerbate inflammation of the guts.
Yeah.
So when an animal has inflamed guts, they're being sick, they've got diarrhea, we take them off of their anti-inflammatories. We don't treat with that. Whereas some of the anti-inflammatory herbs are better for gut inflammation. And chamomile. That's why people drink chamomile.
Yeah.
For upset guts and things. It's also carminative, so reduces gas and that sort of thing. So herbs are quite nice for gut related issues, I find, because adding more medicine to the situation when it comes to guts can sometimes make things worse or impede what we're trying to achieve.
Yeah. Tony, love you for writing this, you wizard, you're absolute stunner for saying something, because yes, this is what we want to encourage. So struggles on fairly short walks, looks like he wants to lift home on the last bit. Should he be on pain relief? I would definitely get him assessed. Yeah. So no one from a distance would be, I'm suddenly going to Bette Midler there, from a distance. No one from a distance is going to be able to tell you whether your dog has pain or it could be dysfunction. So my sister's dog here, Tess, she walks terribly. She circumducts, she's wobbly on her back legs. It's not necessarily pain. She had a cervical disc disease. So she had damage to her spinal cord in her neck. So she actually has poor nerve conduction to her back legs. So she isn't actually in pain there, but anybody watching from afar driving past will think that she's crippled with arthritis. So what I would definitely say is your dog needs to be assessed by a vet and that decision to be made. And if there is a suspicion of pain, you can either go down a diagnostic pathway, which means clinical examination might lead into imaging any suspicious areas, or if with your consent, you can go down a medication trial and see what impact it has on your animal. Because, and I know Chelsea agree with this, which is great because I love having her here, is that the one thing that we do know with the medications we use, we know how quickly they take to work. And so generally, if I was to see you and we both agree that pain could be underlying it, and we decided to go for a clinical trial medication type thing, I know that if I sent you away with, say, 2 to 4 weeks of a non-steroidal, when I saw you at the 2 to 4 week point, I would be expecting to see some improvement. And that would then tell me, yes, there is underlying discomfort that we need to look further into. So please go and see your vet. Thank you so much for writing that. High five. What else have we got down here? This one, another blooming good question. Judy gets gold stars tonight because this is how my brain worked right at the beginning of what works. And I ain't got an answer for you.
I guess for me, it depends on how much we do all at once and what I'm trying to achieve with each therapy. So there are times where I'll put an animal on Medicam and gabapentin at the same time, and they improve. But I know that the gabapentin that I'm giving that animal, I'm looking to reduce nerve type pain. So this is an animal that's jumping up suddenly or crying out or that sort of thing. So is that reducing that? So sometimes we have very specific markers for each thing, as opposed to the anti-inflammatory will be for the actual lameness because that joint is inflamed and sore and arthritic. Let's wind that down. Sometimes we stagger the starts so you know what's working, what isn't. So I think it depends on what your goal is with each treatment. It depends on how staggered your approach is or can be. Some animals, straight away, it's like, I've got to give you everything. Just get you comfortable as quickly as I can, and then we'll unpick it after. So it really depends on how much you have to do immediately if you can stagger it. When it comes to herbs, it can be a little bit trickier because it depends on what it is you're looking for and at what point in all of it you start the herbs. So with arthritis, it isn't always a case. It's not as cut and dry as if I've got a patient that comes to see me who's got liver disease or high kidney values, because I can take bloods and watch what happens with the bloods. Are my herbs helping or not? With arthritis, it may be a case of once we've got the pain management on board, I feel like the joints are a bit more comfortable, but I am looking to get a bit more, better quality sleep. Might be one of the things that we're looking for. And I use herbs a lot for that. It might be a case of, like I said, about the tight muscles and things. So yeah, generally the joints feel a bit more comfortable. They seem a bit happier, but the muscles are still like this. Usually I would be adding in some physical things, but if I think we need to help that along, then maybe I'll add, the herbs in at that point and say, that's what we're looking at. It gets a little tricky because I tend to blend them. We all tend to mix them. So you're getting that holistic approach. But it really depends on what you're attempting to treat with each of them.
Yeah, I agree. And I think a definite 100% take home is this is no longer considered a unimodal disease. And I can remember a few years ago, Dr. David Dykus, he did a brilliant video for us. And he just went, a unimodal approach of just prescribing one medication is close to neglect. And I was like, oh my God, say it as it is. And it is true, because the clinical impact osteoarthritis has, it's not just pain. It has different effects on the rest of the body. So trying to find one intervention that's going to encompass everything that you want to achieve is not possible. So a very classic situation would be an anti-inflammatory working on the nociceptive pain and the inflammation, but hydrotherapy to relax muscles and soft tissue, followed by some underwater treadmill work or some active swimming to try and rebuild tissue, as well as therapeutic exercises at the home to try and maintain it during the week, and avoiding the slips on the floors and coming down the stairs and damaging tissue. And you can allocate them to different, I'm doing this, I'm doing that, I'm doing that. This comes together like a brilliant spider's web, my little jigsaw. So being able to say what has worked is really harsh. As a kind of maternal figure, I think if you're spending a lot of money and you're beginning to go, this is breaking the bank, and I did. Oh my God, you should have seen my credit card. It's incredible. I think I spent $3.5 grand in the last month of Holly's life. I just went nuts. Absolutely nuts. And the reason I'm really passionate about it is because I've been there late at night with an iPad buying anything. You just need to kind of like be kind to yourself. A lot of these marginal gains, they're marginal gains, and you can create a marginal gain by sitting down and cuddling your dog. And I know that's people are going to go, how dare she say that? I bought everything. But when I actually look back what Holly wanted, she wanted me and she wanted my time. And so don't do, you know, buying your way out of it. Your dog loves you, you know, and your dog just wants you. And I think we forget that the emotional, I'm going to cry, the emotional impact of spending time with them is really important.
It's massive. I say that to owners a lot. It's, you know, we don't necessarily know how much time you may or may not have left, depending on where we sit in the progression of all of this.
Yeah.
But I want you to be able to remember whatever time you have left with your dog as good time with your dog. Let me worry about the medication and all of that and stress about what the next step is and that kind of thing. Let me do that. You just spend quality time with your pet, because that in itself is medicine. Yeah,
I totally agree. Right, we're going to have no more than another 9 or 8 minutes because we're doing it again. I know what we're doing. This is a good question, and we had somebody talking about this the other day. I think it was Amber Batson on the Big Walk page. And her viewpoint very much was that essential oils are very strong. And considering that we have dogs with the ability to pick up cancer, for God's sake, us using essential oils can be quite blunt.
Yeah.
And she's quite careful with anything to do with the olfactory system. What do you think?
Yeah, I agree. I do use essential oils in small amounts sometimes.
Okay.
So it's not something that I'm using regularly. It's very specific cases that I've used them for. I do know some vets who use them regularly and have specific training in essential oils. I have small amounts of sort of self-taught training, which is why I'm only kind of dabbling here and there. But you have to be really, really careful with essential oils. They're so concentrated. Some are toxic, particularly to cats, but dogs as well. But cats are really, really sensitive to essential oils. And that can just be inhalation of essential oils.
Yeah.
Certainly ingestion and topically, but even just inhalation, smelling it can be toxic with certain ones and certain combinations. The other problem with essential oils is oftentimes it's the quality of the essential oil as well. So a lot of the sort of cheaper brands, the over-the-counter cheap ones that you can get, have carrier oils in them as well.
Yeah.
And that can be the toxic bit.
And we won't be able to pick up on it. It's a really good illustration of this. You know those little balls that you rub on your forehead? Did you ever have them at university? Yeah. I'm the sort of person that would do my whole forehead, all down the side of my face, underneath my chin. I'll absolutely saturate myself and just be there in like this haze. That would be horrendous for a dog.
Yeah.
So I'm trying to demonstrate to you guys, I would not be the person to decide how much to use, being an addict myself.
Yeah, I'm the same. So certainly not even from a medicinal point of view, but if you're someone who uses essential oils and diffuses them at home, you have to make sure that you're ventilating and that your pets can leave the room and get out of the area if they want to.
Yeah, absolutely.
Even if it isn't toxic or going to cause a reaction, it is horrible being stuck in a room with a smell you don't like.
Yeah. No, that is
Because we will. It doesn't mean they will.
it's totally true. And what I like might not be effective for others. Okay, let me look. There was another one. This I think is a really, really Lynn, you're on fire tonight. Yeah, 100% about using good quality food. What people feel is good quality is still very much on a hot topic, isn't it?
And I think that one comes down to that often us versus them, although there's lots of different camps on that one.
I don't know now.
Yeah, I know there's loads of that. I'm not going to get into any of it right now, but again, it's that, we just need to take a sensible approach to things.
Yeah.
And I think diet absolutely is sort of the cornerstone of and the foundation of health. Do as I say, not as I do.
Oh.
But it again, not one size fits all. No one size fits all with diet.
No, I agree. And I also, just being clucky mother hen here, is that what you can afford both financially, physically, time-wise might not be what somebody else. And many years ago, we've only ever banned 2 people from camp in the whole time we've run it, and we've now got nearly 49,000 people just on the main page, because they bullied people into feeling inadequate as owners because they didn't have the time and the money to do fresh or raw or home cooked. And I was despicable. I'm sorry, that is despicable. You worked to within your means. It doesn't mean you don't love your dog. So there you go.
Absolutely.
Last one. Okay, last 2. So because Kaz is always, she's over in New Zealand, so this is early doors for her. Well done, Kaz. What sort of time frame do you follow? Is it regular visits like physio or further spread out? I was actually told from our vet about another vet who does add herbs, particularly interacts, etc. But not sure if I can afford throwing in another area or keep seeing how we go.
It's a tricky one for me to answer because I'm often doing other things. So I see my patients regularly because I'm doing acupuncture and whatnot. So I'm seeing them quite frequently. I do have some patients that I only see for herbs, and some of them travel quite a distance. Again, it depends on what we're treating. So I'll see them for their initial assessment. We'll get them onto some herbs. And then depending on what it is that my outcome measures are, what it is I'm looking for, that will dictate when I see them next.
Okay.
So if it's something that I think is going to take some time, I might say, right, I'll see you again in 2 months. And then we'll go from there. In the meantime, they can email, they can give me updates, that kind of thing. This is why I find herbal medicine really hard to do from a distance, because I like to see them back again. Ones that are on sort of regular long-term herbal remedies from me, I still like to see every 6 months, just like any sort of conventional medication. I also like them to have bloods regularly, like any conventional medication.
I agree. I think there's just some foundational things that should be included no matter the approach, and being aware that because you have one condition doesn't make you suddenly immune to everything else, and you can be completely curveballed. And that's happened to a lot of my clients, actually. They've done very well with their chronic pain management, and then they've been blindsided by a liver tumor or some other condition.
Splenic tumors right now. I have so many patients with splenic tumors
right really? Now. No, I was just about to say splenic tumor as well. That's another corker.
That's the one that always blindsides. Yeah.
Yeah, so do keep having checkups. You're not because you're busy with one thing doesn't mean that there's not going to creep up on you with something else. Yeah. Last question. Feedback for my pointer. His fecal incontinency, please, if you can. He's on Librela. I swim in weekly. I do physical rehab.
I think it comes back to, it's hard for us to give advice when we've not seen the patient. I think there's so many different things that could cause fecal incontinence.
No. Same boat. My sister's dog, as I say, I'm house sitting for her, and she passed feces last night during the middle of the night and woke me up. Her stool consistency is really good. They're very well formed. She's not going more frequently than we'd expect, but she has got myelopathy. So she is losing her awareness of her feces sitting there waiting in her rectal passage, and all those cues that we have that we probably aren't even aware of, that it's time to start heading outside. There isn't really anything that I can see that I am going to be able to do for her. I can't change her stool consistency. I'm not going to be able to change what is happening with her nervous system. They could argue with acupuncture. You'll be high-fiving me. I did do some last night, but so far I haven't seen any change. But it is difficult, isn't it?
Yeah, it's tricky. And it could be any number of things. So it may be pain related. One of my long-term patients today has just started with not so much fecal incontinence, but almost fecal retention. She doesn't like to squat. And that's pain related. Her back had flared up. But it could be spinal, it could be nerve, it could be dietary, it could be any number. I'm sorry, the pug's barking. Yeah, so it's I would say you'll need to have to get booked in with your vet and have them checked out.
And have a chat. And tips for you would be preempt that it's going to be a long conversation. So speak to reception and say, this isn't a quick fix. This is definitely a counselling conversation. Can I be seen at the end of surgery? So if we overrun a little bit, can I book a double appointment? Do you have a nurse service that they can coach me through management methods? If the vet feels there's nothing more we can do, they can give me tips and advice of how I can continue to have a good relationship with the dog, even though we have the risk of incontinence. So do speak to your vet. Be willing to try different things. Nothing's going to come with a promise, but best of luck. And I'm not going to put Jono's up because he knows that I can't. Jono, I'm not ignoring you. I'm totally accepting your presence. Thank you so much, Chelsea. It's been a really, really wicked live. And what I love about chatting with you is that we're really open to discussion. And there is no you telling people how it is. There's this real honesty about where it fits in and how it can be done with the animal's best interest, and it isn't a case of them and us, which I think is fantastic. So thank you so much. I hope everybody else says thank you too. And
thank you, because I know that this is one of those sort of topics that can be a bit hot, and like you say, is the them and us, and you get lots of people on both sides, so it's nice to be able to have a big platform to talk about it from all angles. And so
yeah, and I think that's what I would really like from Cam, but you have to really choose your speaker that can take challenging questions, not get defensive, talk very openly, because it's not a personal attack. It's very much of how can we help these people make the decisions that are right for them. And I definitely feel that when I'm working with my owners, I'm not just treating the dog, I am treating them too. And if it's a journey that they would like to go down, I want to help them. And if it means that they see things that make them sleep well at night and are happy, that's an addition. If they can afford it and it doesn't come at the expense of other interventions, I'm happy for them. And that's how I feel.
So if you can't, that's okay. And there are definitely times where I've taken pets off of herbal options and said, you know what, your money is better spent in other ways. Let's focus on something else. Definitely.
Cool. Okay, so tomorrow we've got another tricky topic. I'm just going to get them out of the way this month. So we've got the wicked Stephen Sital coming back to talk about CBD. And CBD is a very, very difficult topic here in the UK because it is now considered a medicine by the VMD. So being able to talk about it without looking like we're promoting it and getting into trouble is very, very difficult. So it's going to be a very generic, factual talk, looking at evidence of what's available. There will not be any product promotion. I'm not going to be giving you out dosage regimes and where to source things. We're just going to be trying to have a really good look at the evidence. And there's going to be things that you probably don't want to hear. So that is tomorrow night at 7. So I will see you then. Until then, see you later, guys.
Thank you.